disorder, intellectual disabilities, learning disabilities, and cerebral palsy, amongst other neurodevelopmental disorders. She has been working in the pediatric neurodevelopmental field for over 12 years. Her research interest includes factors that affect child development and how to support children who are differently abled to achieve their full potential. She's an advocate for children with special needs and their parents. She's involved in a number of boards of various non-governmentals and education centers that cater to children with special needs. So, Marilyn, your profile speaks for itself, and we are very honored to have you. Please, the floor is yours.
Thank you.
Take it away.
Thank you, Soji. Am I able to share my screen?
Absolutely. I think you'll be giving some co-hosting rights.
Okay, great. All right. Let me share my screen and make it a slideshow. And we are good to go. Thank you very much, Soji. And thank you, class of 1993, for inviting me to join you. As Soji said, we are talking about managing the health of your child. So it looks like we are about 10 so far. So I hope it will be as interactive as possible. And if for any reason I haven't covered something that is bugging your mind or pertinent to you, when it comes to the discussion part, we definitely can cover it. I try to be as broad and as general as possible so we can cover a lot of things. So, general principles before we go into details. For health of children, and actually for all of us, these ones are really important. So a child needs very good nutrition. You are what you eat. If you are not well nourished, every aspect of the body does not work well. So good nutrition is really important. Adequate hydration, play and exercise. I'll talk a bit about that. That is really important, especially in this day and age where a lot of us are getting sedentary, especially in this COVID era where kids cannot play and cannot, exercise and go about like playgrounds because parents are afraid. It's really important for us to find other ways and means for children to play and to exercise, because it helps to regulate them. It helps in their attention, it helps in their sleep, and sleep is really important also to consolidate memory, to make sure that they are calm the next day. Then of course, infection prevention, we'll talk a bit about vaccinations, and then regular health checks. For regular health and developmental checks, these are really important. I know for us as adults, we go for health checks. We say once a year or twice a year, you need to go see your family doctor, get some labs done. It's also important for children to have their regular health checks. Most importantly is usually to check that their development is on track, so that if there's any delay, if there's any lack, if there's atypical development, we catch it early and then we are able to do something about it. So as Soji said, we'll go through the different age groups. Let's start from the infant period. So as I said, good nutrition is really important. Exclusive breastfeeding for 6 months. Just a few weeks ago was the World Breastfeeding Week. So we're talking about exclusive breastfeeding. There's so many benefits for breastfeeding, apart from the fact that it has, the total nutrition for the baby. Research has shown that it helps with reducing infections, it helps with reducing allergies, reducing asthma, and most importantly, it helps with brain development. So, breastfeeding is really important. So we said, as much as possible, exclusively breastfeed your baby for the first 6 months. And then after that, after 6 months, we add complementary feeding and continue to breastfeed till 2 years. I know that is very difficult for lots of people when we say continue to breastfeed up to 2 years, but as much as possible, we need to try. And then once they start weaning at 6 months, we want to make sure that their food and their nutrient intake is as balanced as possible. And when we say it's balanced, we want to make sure they have adequate proteins. In the early years, proteins are really, really important, even more than the carbohydrates for children to help them to grow well. Then, of course, enough carbohydrates to give them energy, enough fats, minerals, and vitamins. Children don't like to take their fruits and vegetables. So as much as possible, any way you need to coax them to make sure they're taking fruits and vegetables so that they get their minerals and vitamins is really important. I mean, there are specifics on how much food they need to take. The most important is that after you start weaning from 6 months, in the first 6 months or maybe 6 months to 12 months, the main meal or the main nutrient content will still come from the milk, okay? But of course, you want to start introducing the solid foods. And usually by 9 months, we expect that the baby is having 3 main meals and 2 snacks. Here, let me say that it's really important. Soji, how many minutes do I have, please?
I think if you can aim to present for between 30 to 45 minutes, then we can take questions.
Okay, okay. Yeah, so at this point, let me say that for children who do not like to eat, it's very important not to begin to try and force food down their throats, because sometimes it becomes a vicious cycle. You want them to eat. As a parent, you are worried that they are not having enough. So you find all sorts of ways to force the food, and then they start resisting. They start pushing back, and then becomes a vicious cycle. They're hungry, but they won't eat, and then it becomes something else. If anybody has any issues with picky eaters and things, we can discuss it during the discussion time. And then we talk about hydration. Hydration is really important. It maintains body temperature. It helps with elimination of waste products. It prevents constipation. Constipation is a really big issue in children. And what I've realized is that parents may not take it seriously, or some parents may not take it seriously. But what happens with constipation is that it affects everything. So they feel backed up, so they don't have an appetite, and so they don't want to eat. And because they are not eating and they are not drinking properly, they tend to become more constipated. Sometimes they get so constipated that they have what we call an overflow incontinence. So they are still constipated, but they have diarrhea stools flowing around the solid poop that has blocked the intestine, and then they start soiling themselves. You can imagine how that happens in primary school. They start soiling themselves by accident. It can go into psychological issues. And we have quite a number of kids coming into the clinic with that. So constipation is something that if it's there, it needs to be treated, it needs to be worked on. So hydration is really important for that. It protects against UTI. It helps with good concentration. So when children are dehydrated, they are not able to focus properly in school, in class. So how do we know that your child is well hydrated? So your urine color should be just pale yellow or transparent as much as possible. How much should the child be drinking? So it varies. So let's say between 1 to 18 years, it can vary from 1.5 liters to 3.5 liters. I think I do have a chart or so, but at least 1.5 liters going from 1 year ongoing. Let's talk about play and exercise. So play and exercise, as I said, is really, really important. Play is the child's profession. And so every excuse they get, they want to play. And you see the happiness on their faces when they are playing. And children have been made to play. So as much as possible, whether it's in learning in school, whether it's learning at home, whether it's being at home, please allow your children to play. They learn through their play. Their brains develop through their play. They mature through play. They learn things like cooperation and bargaining, their communication, speech and language through play, and motor and physical development through play. All these things can happen during play. So it's really, really important. It's important to maintain their good health. And childhood obesity is now a ever-growing problem. Some children, and increasingly even in our parts of the world, we are finding that children are obese. When children are obese, we don't usually give them like a strict diet we would give to adults, because they are still growing, they still need all their nutrients. So the only thing we can do is to increase their expenditure, which means increase their exercise. And therefore, of course, it means increase their play. So as much as possible, children should be playing. They should be having at least 1 hour of moderate to intense exercise every day. Exercise is really important to maintain their good health. And of course, it helps them in their sleep. You can imagine, as they've jumped everywhere, they've played football, riding their bicycle, trampoline. When it comes to the night, they can sleep well. And when your child sleeps well, then you can also sleep well. Okay. So that brings us to sleep. Sleep is very important for brain development. We know that children from below the ages of 4 will need some nap time. They'll need nap time during the day, but usually after 5 years, they don't need it again. So if your children above 5 years are not sleeping during the day, don't worry about it. Total sleep requirements range from the newborn, who can sleep almost the whole day, 19 hours in the newborn, to about 9 hours in the teenagers. 9 hours in the teenagers. Regular bedtime and bedtime routines are also very important. So let me talk a bit about the teenagers. So as you can see, I said 9 hours for teenagers, but there's also what we call latency of sleep onset. That happens in the teenagers. And then with the advent of screen time and teenagers having phone, it's even worse. So latency of sleep time means that naturally, once they get to the teenage years, they don't feel sleepy early. So their bedtime sort of pushes backwards. So ideally, they would want to sleep after 11, midnight. If they have gadgets they are using, that even worsens it, because the screen behind the gadgets just disrupts the melatonin, or the chemical in the brain that helps us to sleep. It can disrupt it. So ideally, if they were sleeping late, then they should be able to get up a bit late and then go to school maybe around 10. That would have been excellent. But unfortunately, our school system is not like that. They won't allow the teenagers to come to school at 10 a.m. So you need to try and make sure your teenagers are getting enough sleep, because when they are sleep deprived, it then leads into all sorts of things. Their hormones go deranged. It can lead to anxiety, stress, depression, obesity, lack of focus. All these things can happen. And now we are seeing a lot of teenagers with screen addiction. Is acting like a drug, because they are on their phones, on their tablets, on their gadgets way into the night, and they get so hooked on it, they can't put it away. So a regular bedtime for all the children, they should have a regular bedtime. It's not acceptable for children to just stay awake till they are sleepy and then they go to sleep. They should have a bedtime. And if you have a routine, it helps. You have a routine, especially for the younger ones, about a 20-minute routine that tells them that bedtime is coming. So they brush their teeth, they get into their nights where they read a book with mommy and daddy, and then they go to bed. Something short, and it's done all the time the same way. It helps them to sleep. So newborns, as I said, can go up to 19 hours, average of 14 to 17 hours of sleep. By 1 year, they are doing a total of about 14 hours, including naps. They can do 2 or 3 naps in a day. By 2 years, average of 12 to 14 hours, including the naps. 3 to 5 years, 10 to 13 hours. 6 to 13 years, 9 to 11 hours. And the teenagers are expected to have average of 9, so between 8 and 10. And then, of course, adults are supposed to have average of 8 to 9 hours. So let's talk about our vaccination.
So maybe, Marilyn, before you go into the vaccination, I see there are a couple of sleep-related questions here. So maybe you might want to tackle it before you go. The first one is saying that her 10-year-old still likes to catch her mid-morning nap. Is it okay?
Oh, yes, it's okay. So where can I see the chats? Why can't I see them here? Okay, yeah.
I think because you're projecting, it might
be. Yeah, it's okay. So far as it's not going to and disrupt anything. But is she sleeping early though? Catches her mid-morning nap. That's Akosianyonuku.
Yes.
Yeah. If she's sleeping early and she still wants to have a nap, that's okay. So far as, I mean, the routine and everything is not disrupted, I think that's okay. But make sure she's sleeping early, though, and she's sleeping well. She's not waking up in the middle of the night, or she's not hiding gadgets whilst everybody is asleep. Okay. And then...
Okay, there's one related to gadgets. First of all, should they be using electronic devices such as tablets and phones, YouTube, babysitting? And at what age should we give them these devices if you say they should be using the devices?
Okay, so that's one of my favorite questions, gadgets and screen times. So the research shows us that children under 2 years shouldn't be having any screen time at all. So screen time includes TV, phone, tablets, iPads, Xbox, whatever, any screen time. Below the ages of 2 years, they don't need it and they shouldn't have it. It's not recommended because, as remember, I said that children learn through play. They learn through experiential learning. So they need to be doing something. They need to be interacting. When they sit behind the screen, there's no interaction. They just get glued to it. And so those networks for the brain cells that are supposed to be developing their language, their sensory issues, their movements, and their intelligence, they get affected if they are just behind the screen. After 2 years, yes, they may be allowed some screen, maximum, especially on school nights, of 1 hour a day. And then what age should we give them? I think I've answered that, right? I have. Is that okay?
I think so. Please carry on. Thank you.
Okay. All right, cool. So vaccinations is very, very important. It helps maintain a herd immunity. So herd immunity is, I mean, before vaccinations came, we had all these diseases we used to call killer diseases that used to really cause a lot of havoc in childhood, and children were dying. And then we developed vaccines that help to protect children so that they do not die. They have some, like an immunity against these illnesses. And so lots and lots of vaccines have been developed since then. Herd immunity is that you have enough amount of children having immunity against that disease so that it prevents outbreaks. So, I mean, when we started medical school, we used to see very, very few cases of measles. And our lecturers will tell you that when they were younger, they used to see measles a lot. These days, you hardly see measles because of the measles vaccine. So that's an example. So it's really important. I know there are lots of questions about vaccines and whether they are safe and what they do. There are too many and causing all sorts of things. Let's say that vaccines are safe. Yes, they are not 100%, but they are safe and they are really important to protect the children. And without that, the kind of mortality and things we would see in children would be phenomenal. So it's really important for your children to be vaccinated so that they are protected. And then they also do not, if they are not vaccinated, then they do not pose a risk to other people who are vaccinated. Okay, we're talking about regular health checks. So well baby and child health checks, it's really important. We advise that when the baby is born, we see the baby, if you're in a hospital that has a pediatrician, then it's really important that the baby has what we call the newborn exam, so that they have a head to toe check. At 1 week, they're supposed to go and have a checkup, especially during that time. We want to talk to the moms to see that has breastfeeding been established? Are there signs of neonatal jaundice? All those things. At 6 weeks, we still want to see the child. Then after that, every quarter for the first month, and then for the first year, and then every 6 months for the second year, and then after that, once a year, just like adults. So it's really important. During these checkups, it's what happens is that we check on your developmental milestones, the child's developmental milestones. What are they doing when it comes to their big movements, their small movements, their communication, language, hearing, vision? What are they doing when it comes to their social skills, emotional skills? And what are they doing when it comes to their learning? So there are milestones that are checked all these times. This is important because if for any reason a child is delayed or is lagging behind, there are so many things that can be done. And we know that early intervention is the key. Children who are picked up early and started on interventions do much, much better than those who are picked up late. So during those checkups, you have surveillance and screening. Sometimes they'll actually do certain screening tests for you to make sure that this child is on track. And then, of course, then you can ask your doctor all the questions that you have in mind about your child. What are some of the things that you should worry about or should be alarm bells? So very high temperatures. So normal temperature is 36 degrees Celsius to 37.5 and below. Anything above 37.5 degrees Celsius, we say it's a fever. So very high temperatures, 38 and above, you need to seek medical attention. So remember that when you're giving paracetamol for the temperatures, paracetamol is just bringing the temperature down, but it is not treating the reason why the child has a fever. And so if there's something going and just giving paracetamol and it's still happening, you need to go and see a health professional. A child who is persistently coughing, having fast breathing, difficulty in breathing, having diarrhea, having vomiting, these are alarm bells. The last two are important because children can get dehydrated very easily. So if they're having diarrhea and they're vomiting, they can't keep their fluids down. Just the dehydration is what actually causes very severe complications for children. So you need to seek help very fast. Danger signs includes a child who is not drinking at all or breastfeeding. That's for the young ones. Or a child who is vomiting everything, including water. A child who is lethargic, a child who is unconscious, or a child who is having convulsions. Okay, so now I'm going to go into some details about the various age groups I still have time for the various age groups. So let's talk about the newborns or the neonates. So 0 to 28 days. I picked out a few topics that usually comes up a lot in the consulting room. So I think that would be helpful. We've talked a bit about breastfeeding. What I want to say here is that if there are any new moms around, exclusive breastfeeding. Remember that in the first few days, you're not going to get lots and lots of breast milk. But don't worry, the baby doesn't need a lot. So if you look at this one, in the first day, the whole tummy of this baby is this size. It can take about 5 to 7 meals, and then the whole tummy is full. So in the first couple of days, the baby doesn't need a lot of milk. All they need is the few drops of colostrum that is coming out in the breast, and they are fine. Then as they go by day 3, the whole tummy is just less than 30 meals. By 1 week, they can take up to 60 meals. By 1 month, up to 150 meals. So exclusive breastfeeding is really, really possible. Please remember that and share that with your friends. Neonatal jaundice is another thing that we want to reduce. So when children are born, naturally their blood cells are more immature than older than adults, and so they break down faster. And this is what causes the yellowing that we see in the eyes. It's very common in low levels. It's harmless. It doesn't do much. But when it becomes very high, then it can cause damage to the brain. So we are really careful. And that is why we usually say that we want to see the baby before the baby is discharged from the hospital, and then also to see at 1 week to make sure that there's no yellowing of the eye. So as soon as you see yellowing of the eye, make sure that you go to a hospital. Don't listen to anybody who says that just show the child to the sun. You need to check how high the jaundice is. And if it is safe levels, then you can go home and you can do sunbathing or whatever. But if it is high, we need to treat it. And we treat it by putting the child under a blue light that will break down the jaundice and bring it to safe levels. Then we have what is colics and dyschezia and poop. I know new moms are always worried about it. So let me start with poop. So when children and babies are breastfed, exclusively breastfed, usually around the 4 to 6 weeks, they can go even up to 2 weeks without pooping. And that is normal. So if you are exclusively breastfeeding and your baby is not pooping every day, don't worry. So far as your baby is not vomiting everything and the stomach is not bloated and the baby is fine, they don't need to poop every day. Breast milk is is gold. The baby is able to absorb everything. So sometimes there's nothing left for pooping. So they can go. Of course, if they're taking formula, then they can go 3-4 days and then they'll poop. There's something called dyschezia. So dyschezia is when the babies want to poop and you see they become so distressed, they are crying, they are grunting, sometimes their faces become very red, and then before they poop. And grandmas and new moms get so worried something is happening to the baby, their tummy is hurting. And some of the babies, instead of opening up their bum hole to release the poop, instead of doing that, they can't figure that technique out. So sometimes when they want to poop, then they shut the bum hole, and then they're pushing against a shut bum hole and it's not coming and they get really uncomfortable. But with time, they learn. So that's dyschezia. Colics. And colics is a whole big bucket of things. And this is when children are crying. Usually starts around 6 weeks. And sometimes you don't know, especially in the nights, they like to cry in the nights when you want to have your sleep and they want to be held, they don't want to lie down. We don't know exactly what causes colics. Different things is said. Sometimes we think that it could be, if you're giving formula, it could be indigestion from the formula, it could be gas, it could be children not being breathed well, it could just be immature. Sometimes we think it's immaturity of the gut. Whatever it is, rest assured that by the time they are 3 to 4 months, these things have stopped. Sometimes moms will give what we call gripe water or Infacor, Bonisan. These things really with research shows that it doesn't do much to the baby. We do give it so that the moms and the grandmoms are okay, but usually the babies are fine, okay? Then there's something called newborn nasal congestion or infant nasal congestion. And this is when really healthy babies, especially in the nights when they are sleeping, they hear this noise going up through the nose. And then the moms will come and say that they have a cold. Most of the time, it's not a cold. It's just congestion of the nose, because they have really tiny nostrils, and they breathe so fast, and they are drinking milk all the time, and they burp, and some of the milk comes too. So they sound like they have a cold, but they do not have a cold. So don't worry. If you go, your doctor will say there's nothing wrong with it. It's just be okay. So far as the child is breathing well and they are able to sleep well, no need to worry. So this is a poop guide. Where do I start from? Okay. So poop in babies and in children can take all sorts of colors. So the first poop when they are born is called meconium, and it's this dark greenish, almost black color. And then if you have a bright green poop, it could mean the baby is not having enough. It's not having enough milk. And so bile, which is greenish in color, will still be mixed and it will look greenish. If the baby is having formula, they can have green, like a moderately green poop, which is also normal because there's a lot of iron in the formula. They're only these rests. So these ones are really normal poop and no need to worry. This one you have to feed your baby. If you see red, anytime you see bright red baby poop or blood, that one is not normal. It could be an infection, it could be allergy to something you are eating as the mom or something you are giving to the baby. If we see tarry black poop, then it could be a sign that the child is bleeding. If you see white chalky baby poop, that is also not a good poop. We don't like that one. Most of the time it's usually due to some blockage in the gallbladder, and usually these children will have some jaundice. Otherwise, regular poop will have either a whitish, what color is this? Whitish color, and creamish sometimes. And then healthy breastfed babies will have this yellow poop. And then when they start having solids, they have the brown poop. So as you can see, poop can have many colors. The danger ones are the red or black tarry stools, those ones, and then the white ones. Those ones are not good. They're abnormal. I think I've talked about infant colic already. It usually peaks around 6 weeks. It resolves by 3 to 4 months. So these are the babies who are crying usually in the evening, and it's so predictable. They can cry continuously, and we diagnose colic if they're crying for more than 3 hours a day, 3 days a week, more than 3 weeks. That's infant colic. We don't really know what causes it, and as I said, so many things could be the reason. But the caveat is that these children are healthy. So when you go for the examination, there's nothing wrong. They're just doing this crying. Treatments, soothing strategies. So wrapping, rocking, jiggling, carrying, all those kind of things. The grandmas have all sorts of tricks up their sleeves that they can help with. Okay, so that is for babies and the neonates. Then the infants, the things we need to remember. So an infant is between less than 1 year. So for infants, weaning is really important around the 6 months. We want to prevent iron deficiency anemia. And so once they finish the exclusive breastfeeding, whatever you are giving them, we need to make sure that it has enough iron. And most of the time, we will give you some multivitamin as an additional to make sure that their iron levels are okay. Sleep training could occur around this time so that children can sleep. All I'll say about sleep training or sleep in this infant period is that babies need to stay asleep, fall asleep where they're going to stay asleep. Okay, so assuming they're going to sleep in their bed or in their cot, they should fall asleep there, not fall asleep in your arms. If they fall asleep somewhere else and then you take them back, when they wake up in their natural cycles and they are not where they fell asleep, they are likely to wake up again, and that can cause sleep problems. So some parents would want to sleep train, and there are different ways of sleep training. If anybody has questions, we can talk about it. I've talked about constipation already. During this time, infants, when they are crawling, they are now pulling to stand, they start cruising. It's very important to baby-proof your house so that you can prevent home accidents. They can pull onto a kettle with hot water in it, so you shouldn't leave those things around. They like to put their fingers into sockets. They like to put all sorts of tiny things into their mouth, into their nose, into their ears. So you need to baby-proof your house, okay? And we said that they sleep for about 14 hours. The toddlers are from the 2-year-olds, 2 to 3-year-olds. They also need iron-rich foods and also calcium. So the calcium foods, they need to be drinking their milk or yogurt or cheese, anything that can give them calcium. These small fishes, what's it called? Is it the herrings? That's ones too are also good with calcium. This is the era of autonomy. So this is the era where everything is no, I want to do it by myself. They want to eat by themselves. They want to dress themselves, but they can't really do it because they are still young. But you need to give them some autonomy, let them do things for themselves. They may want to feed themselves, it'll be messy, but you should allow them to do it and then clean up after them. Home accidents, you should be wary about those ones too. Make sure that medications are up in medication cabinets, they are locked or they are baby proof or child proof so that they can't open them. They will need a sleep of about 12 to 14 hours. And then we need to support their mental health and build resilience. So as a toddler, how do you support a toddler's mental health? So this is the time where they can have their tantrums. They want what they want and they want it now. Okay. And then they are crying and if they can't have their way, they are crying. It's important for them to know that no matter how emotional they get, there's a safe place they can come to. And for toddlers, yes, we know they can have tantrums. So better to sort of prevent the tantrums. Once they started, you can't really stop it. Find a way to soothe them. Building resilience means that they just need unconditional love and they need to be given a chance to try and to be independent a little bit and learn things for themselves. Okay, school age children. Nutrition again comes in. So school age is from like 6 years, so from class 1 going. They also need calcium and they also need iron-rich foods. So 16 ounces of milk or milk products is important for them. You also need to think about home accidents, them climbing trees and breaking their bones and all those things. They need about 9 to 11 hours of sleep, as I said. And then mental health. These are the kids who are doing a lot of screen time. I talked about screen addiction. So you need to put a watch on that. They shouldn't be doing more than 1 hour, maximum 2 hours a day of screen time. And then as parents, we need to find out what is happening in school. Talk to them on the way to school, on the way back from school. If you don't pick your kids, when you get home and they are not asleep, talk to them, find out what is happening. This is the time where you can, boss with them and find out what they are learning in school, what their friends are saying, if somebody is teasing them. Once you have that kind of relationship with them, if something is happening, they will tell you. Then the adolescent period. Adolescent period. So nutrition is also very good. It's really important for the adolescent period. We need to check their social media and peer pressure. This is the time the adolescents, they are finding themselves, but they also need the acceptance of their peers, okay? They're finding themselves, they need acceptance of their peers. They're trying to be independent from their parents. It's a really tricky period. And so if you've built some relationship with them, there's some confidence there, then you hope that even as they're going, you've taught them enough. You've taught them your home principles that they don't go out there. Social media is a crazy place these days. You need to know what they are doing there. There are perverts and predators out there. You need to make sure that they are not going to all these sites and dangerous places. I've talked about sleep, delayed sleep onset. Make sure that your teenagers and adolescents are having enough sleep. They really need it for focusing. They need it for their emotional balance. They're having hormonal changes there. And so you need to talk. Okay, I can see some questions. I'll answer them when I'm done. We need to talk to them, the preteens especially. We need to talk to them about changing menstruation and everything. The boys also need to know that their hormones are going to be kicking in. Things are going to be changing. Body odor, hygiene practices. You need to check in with all those things. And then, of course, their mental health. So a few more slides left. Myths and misconceptions in child health. So not all high-grade fevers require antibiotics, okay? So you may have a very high temperature and you come and we do the labs and it's a viral thing. Your doctor won't give you antibiotics no matter how high the temperature is. Air conditioning or exposure to cold doesn't cause pneumonia. Pneumonia is caused by viruses and bacteria and other germs. So air conditioning doesn't do that. Teething causes fever, diarrhea, and runny nose. No. So this is also a myth and a misconception that teething causes fever, diarrhea, and runny nose. What happens is that when children are teething, because they are so uncomfortable, they like putting things in their mouth or put their fingers in their mouth. So they are likely to catch more viruses and germs during that time. And that causes the fever, diarrhea, and the runny nose. Formula-fed babies always have to drink water. That's also a myth and a misconception. So we usually say, even if they are formula-fed, if you are doing the ratio of formula powder to water really well, they don't need to drink water. Of course, if they are getting constipated because of the formula, we may change formulas a bit. And if they are still getting constipated, your doctor may ask you to give some water. A baby has to poop every day. I've talked about that already, that they don't need to poop every day, especially the breastfed ones. They can go 10 days. I think the longest I've seen was 14 days without pooping, and the baby was fine. A pregnant mother should not breastfeed. That's also not true. If you're pregnant, if it happens that the interval between the babies were short, and you find out that you have a 9-month-old, a 1-year-old, and you're pregnant, you can still breastfeed. A baby should never be left to cry. All crying in babies is ominous, and that's not true. So remember, babies cry as a way of communication. So babies will cry because the temperature is not good. They'll cry because they need diaper changes. They'll cry because they just want to cry. So not every crying is ominous. Okay. So G, I think I'll stop here and ask questions, feedback and questions.
Excellent. It was really helpful the way in which you broke it down into the various age groups and drew attention to the areas of concern. There are a few questions. I see one from our Vice President. Should children be sleeping in their parents' beds? Certainly the Vice President has better use for his beds at night.
Should children be sleeping in their children's bed.
In their parents' beds.
Okay. Should children be sleeping in their parents' bed? I mean, that's a difficult question to answer. I think it depends on the culture. I would say they need their bed. They need to sleep in their own bed. But as to when you move them to their own bed, I think it really depends on the family. But ultimately, they need good sleep, okay? So they need to have good sleep. And if parents are together and they're also in their bed, then I think the children are better off in their own bed. In the beginning, if, as I said, we are doing exclusive breastfeeding, some moms may feel it's easier for their baby to be in the room so that they can, get up and breastfeed as often as possible and not have to go all the way to the nursery or baby room to breastfeed. But once you start the sleep training, the baby should be in their own room. That's my opinion. There's no, I don't think there's any health reason why they can't be in your bed, but to get a good night's sleep for both parents and children, I think they should be in their own beds. That can happen in one bedroom houses and things like that. But if they can have their own bed, they should. Somebody can't get their 10-year-old out of their bed. Okay, Antoinette, you should ask for 10 years. By 10 years, this is the preteens. And so, I mean, if you and your husband are in your bed and doing things, your 10-year-old definitely needs to be out of your bed. So get them out of your bed.
For sure. I mean, I know this session is supposed to be focusing on the children, but these questions, latter day questions, I think are not about the children. So there's a question from Astrid. Astrid is connecting from YouTube, and she's asking whether you can breastfeed till 2 years. And that I know they have teeth, but now you can get nipple shields.
No, don't worry. Even with the teeth, they can still breastfeed without biting you. So yes, you can breastfeed up to 2 years. That's what we advise, that they're exclusive for 6 months. And then after that, complimentary breastfeeding till 2 years. They won't bite you. Yeah.
Wonderful. And then you also talked about jaundice and the fact that we should treat it with the blue light so that it will break it down. Yeah. So can you say a little bit about the complications? What happens if we don't get to treat it and the jaundice remains? What could possibly go wrong?
Okay. So let me stop sharing so I can see people's faces. So yes. So complications, when the jaundice is severe and it goes, what happens is that it can go into the brain. When it goes into the brain, it causes brain damage. And it can cause cerebral palsy. So cerebral palsy is when it affects their movements, it affects their posture, it can affect their learning, it can cause seizures, it can delay their walking, their talking, it can cause developmental delay. So it's a very serious thing when the jaundice goes into the brain. It can even, if it's severe enough, it can even cause death in the baby.
Thank you for that. There's another question that often comes up in relation to diarrhea. You spoke about diarrhea as a danger sign or a red flag.
Yeah.
And the question is, for mothers ask, are we supposed to give medication to stop the diarrhea? And for some people when the diarrhea is happening, that is the time when they withhold fluids. So what should we really be doing when we have diarrhea?
Okay, so diarrhea, as I said, the most important thing is that we need to replace the fluids, because it's the loss of fluids that causes the complication and that can even cause death in children. So in children, you don't want to stop the diarrhea. We don't give Imodium in children. We replace the fluids till the reason for the diarrhea has been found. So for most of the children, it's a viral diarrhea. Okay, and so once you are replacing their fluids with ORS, that is if they are not vomiting everything, we are giving them ORS or coconut water or just plain diluted apple juice before you get to the hospital. You want to replace their fluids, never restrict fluid. And we don't give Imodium because if it's an infective process, you just stop the infection and it's all inside you, No, it doesn't work that way. Yes, we give adults with cholera and really bad diarrhea Imodium because then they have a bigger capacity and they don't get dehydrated that fast. But for children, no, we don't give Imodium. We rather just replace the fluid till the whole thing has passed.
Thanks.
Okay.
From Awishi Kumsen, what diet should a teenager be on if there are signs of gastritis?
Gastritis. So the person has been diagnosed with gastritis. Okay, so let me be general as possible. So gastritis, which means that they have some hyperacidity in their tummy. Okay, so first of all we say is that don't let them, they shouldn't get hungry. So they should be eating small meals regularly so that they don't get hungry, especially if it's hunger that is what brings upon the pain. Then of course, some people with gastritis, it gets worse with spicy foods and it gets worse with like acidic foods. So it really depends on the child. If you know that if they take spicy foods and they take acidic like green oranges, green apples, it gives them pain, then they shouldn't be on it.
Thank you. So from Antoinette, what causes tics in children?
Tics. So we really don't know what causes tics. We just know there are these repetitive, involuntary motor movements that can happen. Most of the time, they wax and they wane. So they'll happen a little bit and then they'll stop. So we don't treat it if it is not affecting the child. So, and it could be anything. It could be blinking, it could be head movements, it could be complex tics. If it is not affecting the child, we don't do anything about it. Some of the tics could be complex enough that it's affecting, especially the vocal tics. So they are making all sorts of noise in the classroom and it's disrupting everything. That one we can treat. But as to really what causes, we are not very sure. Lots of our neurological things, sometimes we are not sure. We don't know exactly what causes tics. Yeah.
Thanks for that. Last but one question. Should we be giving vitamin supplements to children?
Okay. So I talked about iron deficiency anemia, which is something we need to prevent when we start weaning. So yes, what the research is showing us is that from the 6 months, there's this big need for iron to keep it maintained. And most of the time, we realize that the children are not able to take enough fruits and vegetables to keep up that's their iron and their minerals intake. So yes, most of the time we do give them some supplements once they start weaning. We do.
Okay. I think you've said a bit about sleep training. And it would be good if you can give us a few practical, perhaps say a bit more about it and some suggestions to help us to deal with some of the sleep difficulties. For example, there's a question here about how one should handle school-age children who do not sleep throughout the night. They wake up at 3 a.m. tossing and turning. So if you can link this together with the comment you made on sleep training, that would be very helpful.
Okay, so well, let me start with saying that sleep training can be very difficult, okay? And usually if you want to sleep train your child and you're one who can't afford for your child to be crying, you're better off letting the partner who is hard to do the sleep training. And because so you need to do it early, okay? So the thing with sleep is that all of us, so let me give you an example. The principles behind sleep training. All of us have sleep cycles. And so we have these 90-minute sleep cycles where we go into deep sleep and we come up a little bit and wake up a little bit, but we're able to go naturally back into sleep, okay? If you fall asleep in your bed, imagine you fall asleep in your bed and then you wake up during the sleep cycle and you find yourself in the garden. The natural thing you do is, hey, what's happening? Why am I in the garden? You wake up. And that's what happens to the babies. If they fall asleep in a different place than where they're supposed to stay asleep, it usually disturbs their sleep. So the basics and principle of sleep training is to get the child when they are sleepy but not fully asleep in the place where they are supposed to stay asleep. So we have different methods. So you can hold your child as soon as they are feeling sleepy, almost asleep. You put them where they are supposed to sleep and be by them and pat them. If they cry, you continue to pat them. Or you can leave them in the bed to fall asleep, and they cry it out and they fall asleep. Or you can keep on going and patting them and going and patting them till they go. There are different things that you can use. But the main principle is for them to fall asleep where they need to stay asleep. For the 10-year-old or the school-age child who is waking up at 3 a.m., you need to find out what the problem is. Do they need to pee? Is the room too cold for them? Why are they tossing and turning? You need to find out exactly what it is and make the conditions as conducive as possible. If they're actually waking up, they could be having nightmares, they could be having, what do you call it? Or they could be just a periodic limb sleeper. So there are some kids who just move a lot in sleep because they are light sleepers. But you need to find out exactly what is happening. If they're actually waking up, you need to just let them go back and stay back.
Yeah, you seem to have stimulated a lot of interesting questions and discussions. So I have a few more coming through, so I'll take them. Awishi comes in again is asking whether the teenage girls can take folic acid every time they menstruate or just sometimes.
Okay, so they don't need folic acid for the menstruation unless they are anemic already and they are on folic acid with other supplements. We ask folic acid for teenagers or young ladies because of the fact that we want their folate levels to be at par when they get pregnant. So if there's no chance of your teenage girl getting pregnant, then they don't need to take folic acid during menstruation. I hope that answers the question.
Yes, yes, it does. So I'll focus the last two questions on mission and your work. Okay. And you have subspecialized in neurodevelopmental issues, autism, attention deficit disorder, and the like. If a parent were to ask you, is there really hope in this category of patients that you see, seeing that you're an advocate, what are you really going to say to that? Because I have sometimes even come across parents who are thinking of relocating to Ghana, and in their minds, there's nothing to do, no schools to attend, no specialists to see, the health system will not be able to address their needs. It's what they think. But I know you've been doing quite a lot of work in this area, so it'd be good to just give us a sense of what is happening in the landscape as far as the neurodevelopmental issues are concerned.
Yeah, thank you for that. So yes, there's tons and tons and tons of hope. And that's why I'm always stressing about the early intervention. So they're picking up. So now in the past, we used to, because we were not picking them up or because we weren't sure about it or we didn't know, they were coming in very late. And when you have a child on the spectrum like autism coming in at 10 years, most of the time, if they've not had any therapy, it's really hard for them to gain, all the skills. But if you're picking them up early, and that's what is happening now, 2 years, 2.5 years, and there is therapy available, yes, the prognosis is really good. I have kids who are communicating verbally, they are in regular school, they are top of their class, because autism doesn't mean that you are not thinking. Most of them are quite brilliant. So yes, there's hope. Of course, the amount of resources we have is not like the Western world. And unfortunately, it is not subsidized. So it is expensive. And we need lots of help to fund this thing. We need governments to start thinking about them about kids with developmental issues because they are like, I mean, they're also Ghanaians. And so that's it. It's expensive, but it is available. There are lots of schools, there are lots of therapists coming up. It's not as much as we want, but we have a training school for speech therapists. So they're churning out speech therapists all the time. We have one for occupational therapists. Some behavior therapists are being trained in the country now. So there's much hope now than like 10 years back or even 5 years back. Yeah.
Okay, so we'll leave it here. But before we do, if you could share some of the details about Mission Pediatrics. I've got some question about where it is located. If there's a phone number or something, if you could just say a little bit about the clinic itself, because these questions have come through, it would also be helpful.
Okay. So Mission Pediatrics, we are located at Kokomlemle, Olympic Street. Is 10 Olympic Street. It's around Joy FM. I will send Soji a location pin. I'll put our number there on the chat room. We are, as Soji said earlier, a children's practice. It's an outpatient practice. And we see children from 0 to 18 years. We have, it's a multidisciplinary team. And even though we see all children, both general pediatrics and children with developmental issues, our specialty is in developmental issues. So we have psychologists, we have speech therapists, we have behavior therapists, we have occupational therapists, and psychiatrists. We have a child and adolescent psychiatrist also there. And we work as a team to make sure that the kids who come to us get the best that they can. And now we are working with schools too. So we have some partnership with schools so that we give therapy to children in the school so that they don't have to miss school. Soji, is that enough?
Yes. So okay. I will be sending the details when it comes through to the colleagues. If you could pardon me to just ask one more question, which has just come through.
Yeah.
What really causes autism? Seen a lot these days, you know, and how do you handle their social life?
Yeah, that's the $1 million question. So what causes autism? The research is telling us that it's a multi-genetic condition, which means that it's due to changes in genes, okay? What causes the changes in genes is what we haven't figured out yet. We are not sure, okay? But what happens is that the change in the gene could happen either in that child or it could have happened in generations past. But we know that apart from the fact that it's multi-genetic, we think there's also an environmental factor that sort of triggers. So when you have the change in the gene, it gives you the potential to have autism, but you sort of need something to trigger it for you to have the autism. So you can have 3 siblings who have the same genetic makeup. If you do the gene testing, they may all have the changes, but one has the autism, one doesn't have it. And if you look into the family tree, you may see little aspects of the traits in autism in the general population, but not enough for us to say that they have autism. So, I mean, 100%, we are not sure exactly the origination, but we know it's multi-genetic with some environmental triggers. That's the short answer.
That's a short answer to a complicated question.
Yeah.
So thanks a lot. On behalf of the class,
one more
Dr.
question.
One more question.
Okay. No, Norris.
Can you either dispel these rumors or perhaps add to this link people are trying to make with vaccination and autism?
Yeah. Good question. Yes. So yes, it is obvious, totally not true that vaccines cause autism. And there are lots and lots of papers that have come up, researches. I think the recent one that I saw was in the Scandinavian countries, and they looked at over, I think it was about 230,000 like children. It was a really big one, and looked at those who had taken vaccination, those who hadn't taken, retrospective, and there was no link between vaccines and autism. This whole myth started with one doctor in the UK who falsified his research on MMR with very few children. There were about 10 or 14 and brought it up. Later on, they found out that he had actually falsified information, and that paper was withdrawn and it was taken out, but it sort of carried on. The thing too is that, so as I talked about autism with their genetic makeup, these kids will come and usually within the first year, maybe developing well, really up to 18 months. And then we start seeing the signs, the obvious signs around 18 months, which sort of coincides with the time that we give our MMR vaccination and the measles rubella vaccination. So sometimes it fuels that myth, but the research has shown really clear that there's no link.
Okay, so let me pause briefly.
Thank you. Yep, thank you.
Let me pause briefly to see whether there's any other question.
Yes.
I can see a hand up.
Okay.
Or it's a thumbs up.
Peterkin is a thumbs up, but Peterkin also has a question.
Yes, sir. This is just a quick one. Again, it may be a myth, but difficult childbirth or difficult delivery and its relationship with autism. I happen to work in the health field, and there has been a lot of litigation in the UK at the moment we're dealing with, where they legally we are now sort of trying to say that the negligence in the process has led to a spectrum being a form of autistic spectrum diagnosis. Has there been any research to your knowledge that is working with that?
So you remember I talked about the environmental factors that take about 5% of what sort of triggers the potential. So remember that without that genetic potential, the environmental factors will not work. Okay, but yes, the environmental factors coming up are a lot, and these are risk factors. They are not causal factors. So it includes prematurity, includes birth complications like birth asphyxia, includes infections in pregnancy. Even papers of giving paracetamol in pregnancy has come out, but none of these have been able to prove a causal effect. It's all risk factors, paternal age, maternal age. These are all risk factors, and nobody has been able to actually pinpoint how these risk factors interact with the genetic makeup to cause autism. So no, so birth asphyxia does not have a causal relationship. But yes, there is some papers talking about risk factors about that.
Thank you. Thank you very much.
Okay. So, well, Dr. Marilyn Marbell-Wilson, on behalf of the class, I just wanted to say a big thank you to you for making yourself present. I think the presentation has been very informative, very well researched, very practical suggestions for us to work with, and with a lot of nuggets. I'm taking away what you said, that play is the child's profession. Hopefully it will help me to be kinder to the people in this house. But it's really been wonderful, and I've thoroughly enjoyed myself. And certainly members of the class have been most engaging. I would have expected no less. Questions flowing, nice, interactions, and I'm grateful to you as well. So with that, we'll bring the curtain to an end. Christopher, would you want to say something, or do we close the curtain?
Yes, sir, please. We close the curtain.
All right. So thanks. So we